In 2004, in the journal Nature Medicine, this year's laureates of the John Dirks Canada Gairdner Global Health Award, Drs. Peiris and Guan, they warned that emergent zoonotic disease would be a persistent threat to an increasingly global society. They wrote that nature remains the greatest bioterrorist. Well, we are living that reality today. Dr. Peiris and Guan's groundbreaking work on SARS-CoV and emergent zoonotic disease is being recognized for this award. And I take it as an opportunity to consider nature. Nature, which is of course a reservoir of zoonotic disease, but nature also that is the forests that make oxygen for us to breathe, or soils from which our food grows. So let's pause to examine, what role does non-human nature play in determining health? I'm Dr. Sarah Elton. I'm a critical qualitative health researcher. I'm joining you today from the traditional shared gathering grounds of the Haudenosaunee Nations through the Dish with One Spoon Treaty and the historical home of the Wendat Nation. Today I ask, what happens if we challenge the widely held view that humans are the supreme species? What happens if we consider the agency of non-humans in public health and medicine? It's a good time to consider nature and health during this time of climate change. If we want to advance human health, we must really understand these relationships, whether they be positive, negative, or neutral. I use the term relational health. In a relational health view, health is a constantly unfolding process that is produced through relationships between humans and non-humans. And there are numerous scholars in the social sciences who are investigating these relationships. We know that sometimes the results of these encounters between humans and non-humans are not good. For example, diarrheal disease. According to the World Health Organization, it is the 6th leading cause of death in lower income countries. Then, of course, there are emergent zoonotic diseases like Lyme disease, Nipah virus. Mostly, however, the encounters between humans and non-humans are positive, as is summed up by this public health concept, the ecological determinants of health. This concept recognizes that we would not be healthy without ecological processes. Well, we wouldn't be alive. Oxygen, food, and water are ecological determinants of health. So too are soil systems and water systems, as well as many other aspects of the biosphere that our health depends entirely upon. I work with post-humanist theory to consider the implications of seeing humans as equal to non-human life forms and systems. So post-humanism is an emerging area of the social theory in the qualitative health literature that rethinks relationships between human and the environment, or as a post-humanist would say, between humans and non-human nature. A post-humanist would say non-human nature as opposed to the environment, to acknowledge that humans are in fact part of nature. We do not live apart from nature. We are just one of many species here on planet Earth, and we cannot be separated out. This post-humanist view runs counter to the dominant Euro-Western worldview that has been widely held since the Enlightenment. This Euro-Western worldview sees the human as the supreme species and the rest of the world as just resources to exploit. This worldview has profoundly shaped society ever since Euro-Western society and colonialism and globalization spread it around the globe. Kim Tallbear calls this separation of humans from the rest of life on Earth. She calls it the settler colonial nature culture binary. And it's bound up in many socio-political processes, including settler colonialism. So the idea that humans live separately from nature, this is just an idea. It is a social construction. It is not a fact. It's important for me to recognize that this Euro-Western idea that humans are separate is not a universal outlook. Many cultures, including here in what we call North America, in Australia, as well as cultures in Asia and South Asia, people have long believed that humans are one of many actors on planet Earth. So post-humanism is not a discovery. Rather, I like to think of it as an engagement with long-held ideas and ontologies. So as a social theory, post-humanism is a lens. It's a lens through which we can look to interpret the world. So this lens decenters the human, It makes humans equal to all other life forms on planet Earth, and it recognizes that non-humans, that nature has agency. It's also been said by other scholars that post-humanism gives us the theoretical and the ontological tools to grapple with this relationship between humans and non-human nature in the context of health at this point in history. Of course, there are other scholarly approaches to understanding health and human health and the natural world. For example, planetary health, eco-health, to name two. However, it has been observed by other scholars that these approaches have had a minimal impact, a marginal impact on mainstream public health and medicine. I draw on post-humanist theory in my fieldwork. One site for my research are food-producing gardens. So in the garden, I explore how health is produced through relationships between people and plants. Plants have agency in health relationships. Of course, plants are not like us. They don't act with intent. That is not the source of their agency. Rather, plants have agency because they influence, they shape, they make things happen in relationships. But really, to see plants as health actors requires a shift in worldview. I'm going to explain using the vegetable garden for my fieldwork as an example. So plants in the vegetable garden produce food. They produce healthy food, vegetables for us to eat. Also, the participants I interviewed in my study, they reported that just gardening, being in the garden, boosts their mental health and also their physical activity because you have to move to garden. So the literature on gardening does support this view of gardening as a healthy activity. And then also, the plants depend on the gardeners. They depend on people for water, for weeding, for good soil, for good light. There's this interdependence between people and plants, and it is through this interdependence that the plant's agency emerges. I did my fieldwork in a neighborhood that is being redeveloped from a social housing community into a mixed income area. Regent Park in the city of Toronto, where people have been growing food for decades. So to remake this neighborhood involved building condos where there used to be gardens. And the residents wanted space to grow food. The people who lived there all this time, they wanted to continue to do that. And they wanted gardens to be included in the design. So they advocated for them. And in fact, they were included on rooftops and in the big park. The design of the new neighborhood was changed to accommodate the material requirements of the plants. So this is one example of how non-human agency is expressed when something happens because of relationships, because things are interdependent and in constant interaction. So this supports a view of relational health as a relational process as opposed to a status. So health is not something that I possess in my body, rather health is constantly being produced by relationships of all sorts at many different scales in society. Scholars like me, who study the role of plants in society, call this vegetal politics, the way that plants are imbricated in socio-political processes. A garden is just one example. Other sites of this socio-political mixing between humans and non-humans in a health context that I study include the human microbiome, and I also do work at the Ontario Food Terminal on produce supply chains. So in all of these sites, again, health is a co-production. Health is relational. Because non-human nature has been so frequently left out of conceptions of health, that means there's so many questions yet to be asked about relational health, about the ways that non-human nature produces human health. Like, how might understandings of global health change if non-human agency were to be recognized? How would your work change if non-human agency were recognized, or relational health? Awareness of non-human agency also invites engagement with ways of knowing in Indigenous philosophies and Eastern thought that already have sophisticated understandings of the relationships between humans and non-humans. Emergent zoonotic disease, climate change, if there ever were a time to pause and consider nature's agency, that time would be now. Thank you. It's been an honor to receive this Early Career Researcher Award and also to address you today.